Hey, welcome. So today we're going to be going over the cross-fibering recipe for the chest and arms. As we get started, of course, our client's going to be face up for this one, or otherwise we say supine. So the first move that we're actually going to start with is a cross-fiber or a trenching of the intercostal spaces. Before we can do that, we'll actually have to go ahead and undrape our client. So in this particular case, notice my client's arms are over the drape. In order to be able to do this really well, we're going to bring the arms underneath the drape first. Great, and in order to make a good drape for the chest, first thing we want to do is create a nice crisp line at the top of the sheet. We're going to take our cover and we're going to place it below their chin, connect the lines, and then take the drape down. Okay, at that point we can kind of hold this in place, bring the drape the rest of the way down, create a tuck, and then this likewise can create a tuck. A lot of times having the security of feeling it wrapping the chest and going under the arms brings a little bit more comfort. So in this case, now that we have the chest undraped, we're going to be going for the intercostal spaces. Now my bow stance is going to be facing diagonally up the table. My push and pull is going to go roughly in this direction, so my front foot is going to face the same way. I'm going to place my hands on the lower rib cage of the client. I'm going to use my fingers to search out the gaps between the rib spaces, so the intercostal spaces are the spots between the ribs. And basically once I find them, I'm going to use a moderate pressure, and I'm going to use kind of a more pointy, either fingertips or finger pads, to kind of trench through here and use a cross-fibering motion to ask for space to be created here. Now as you're doing this move, there's a lot of different spaces. We've got 1, 2, 3. So when you're doing this move, try to feel around and ask yourself if it feels like there's a lot of space between the two ribs that you're working on, or if those two feel like they're more squeezed together. Again, when you ask yourself to feel for more detail in your hands, you learn to see better with your hands. And when you feel two ribs that are really squeezed together, a lot of times this move is particularly good for those ribs, helping to bring space into an area where there might be too much squeeze, too much compression. Now notice that in the front of the chest, the move usually goes this way. As I go around the chest, it's going to change directions a little bit. So again, follow the trench. When you feel the trench changing direction, flow with it. Don't pop out of the trench as you do the work. And you can do more than one. I was focusing mostly on that first one, but you can see I switched here, I can switch again. And sometimes when you get really good at this technique, you can actually flare your fingers out and get multiple trenches at the same time. Now I'm using this space because it's very accessible, but remember this trenching of the intercostals can be done anywhere where the ribs are. So I could potentially be bringing this up into the chest, closer to the sternum. I could be going lateral behind the breast and on the side of the chest. I can even do the really upper ribs up here, just remembering that when I go to an area with more muscle, I have to sink through those muscles to get to the intercostal spaces. Once we cross-fiber the intercostals, the next move that we're going to be working on is actually going to be cross-fibering pectoralis major. Now pectoralis major has an origin that goes we have the sternum and the clavicle, the first half of the clavicle or the medial half of the clavicle. So those are the main two spots we think of. The third spot we want to remember is going to be the costal cartilages. So the sternum is very, very center. The costal cartilages you can think as being an extra 1/2 to 1 inch away from the sternum. So we're going to create 2 cross fibers up and down the rib cage of the sternum and the costal cartilages. And we're going to create 1 cross fiber underneath the clavicle. We're going to start with the clavicle first today. My bow stance is going to go across the table. My cross fiber, of course, is going to be across the table as well. I'm going to pick a spot that's just inferior to the clavicle. And once I have that, I'm going to place my hand, I'm going to sink into the muscle, and then I'm going to begin my cross fiber. As a gentle reminder, remember that when you're doing body work, you want to self-check your elbow when you're doing your techniques. If my elbow is moving, it means that I'm not using my body. You'll notice that in this particular case, my elbow isn't moving because my legs and my core are doing all the work here. So here we are, got the medial clavicle. I did my first spot very medial. My second spot's going to be a little bit more lateral. And we want to stop at about halfway. Once we go halfway, the rest of this is basically deltoid area. So we really want pec major, and that's the medial half of the clavicle. Once we do that, we're ready to move on. We're going to take our bow stance. We're going to face it down the table. I almost always have my outside foot, the one that can go around the corner of the table, is the one that I will put forward. My first contact here is going to be right next to the flat of the sternum. When we do this one, we're going to start near the collarbone. And in this particular case, depending on what you've arranged with the client, you can do this over top of the drape, Or if your client has permitted you and you've spoken to them, there's a possibility that you might remove the drape, or you could potentially go under the drape, though again, be careful because that can be a little bit risky in terms of creating a safe space. We don't generally want to go under the drape. So I'm going to go ahead and again, this is my third position. I'm moving down the rib cage. The pectoralis major has an origin that goes all the way down to the sternum, almost to the xiphoid process. Sometimes I might use my second hand to palpate and try to find where the ribs come together. That gives me my ending point right about there. Okay. Once I've cross-fibered the sternum, the next thing I'm going to do is I'm going to think about this line that I just did, and I'm going to push it just a little bit more lateral. These are going to be over the costal cartilages, the third attachment for the pectoralis major. When we work on this spot, it does tend to feel a little bit more tissuey. It feels like there's more muscle tissue under this spot. The sternum, by comparison, feels a little bit more bony. And oftentimes, as you're cross-fibering over the costal cartilages, you really get the feeling of going over the ribs. Like your fingers can kind of feel like the clack-clack, like you were driving over railroad tracks. And just like with the sternum, we're going to make a few points from superior to inferior. And when we've gotten down almost to where the xiphoid process is, we'll have finished our cross fiber for the pectoralis major. Great. Then we're going to be ready to move on to the pectoralis minor. So for the pectoralis minor, when we address this muscle, the first thing I want to remind you is that we're going to have to lift up the pec major to go underneath and get into the pec minor. So in this case, what we're going to do is we're going to change the drape for the client's chest. Right now we have it tucked under the sides of the chest, but in order to do this move and make it a little bit more accessible for us, we're actually going to take the drape and we're going to fold it up. So what I'm going to do is just untuck. I'm going to take the drape and we're going to fold it to cover the top of the chest, but to show the side. That's going to give us a little bit more room to manipulate here underneath the arm. The client's arm here is already out to the side, but if they start in this position, you can often just kind of coax their elbow open a little bit more to give yourself room to work here. I'm going to take my bow stance and face it mostly across the table, maybe just very slightly upwards on the table. And what I'm going to do is I'm going to use my top hand, the one closer to the face, and I'm going to grasp and lift pectoralis major. It's often really easy to get a sense of grasping that muscle. Once I have it grasped and lifted, I can use my second hand. This is the hand that's actually going to do the technique. And I'm going to place my finger pads on the ribs, and I'm going to walk my hand in, following the ribs until I feel my first little bump as I go across the body. Now, when I first feel that little bump, that's probably going to be pectoralis minor. So once we're there, we're going to go ahead and initiate a light cross fiber. Depending on the client that you're working on, some people are really quite sensitive and even ticklish here. So be mindful of how much pressure that you're using. Okay, so we've got the cross fiber going now. We can start to bring that a little bit more superior, working up the ribs towards the collarbone. And especially once we get up towards the coracoid process where this muscle is inserting, what we can do is we can take and lift this. Now I'm going to kind of switch to using supported thumbs here. We're going to kind of walk our way in until our thumbs are hooked underneath or deep to the pec minor. And then we're going to lift it away up off the ribs. And even as we have it lifted, we can give it a little extra cross fiber here. And this will let you cross fiber much closer to the insertion. The origin, of course, is on the ribs, so we don't want to lose that. But often this is the one that people focus on, so here's a good technique for it. All right, once we've done that, we can bring the drape back down, and we're ready to move on to the arm. So we'll be working on biceps, triceps next. All right, so we're ready to move on from the chest and actually get into cross-fibering the arm. I've gone ahead and taken my client, turned him about 90 degrees. It should allow us to kind of be able to keep talking while I show you these techniques. So our first targets when we work onto the arm in this case are going to be the biceps brachii and the triceps brachii. When we do this work, we're going to be standing on the same side of the table as the arm that we're working on. And in general, our bow stance is going to go across the table. We can generally consider these muscles as going long ways this way, so our cross fiber is going to be going this way, and our stance likewise points in the same direction. Now when we come out and we're looking for biceps brachii, I want to remember that biceps brachii has two origins. The first one, the short head of biceps, comes off of a spot called the coracoid process of the scapula. That's just inferior of the collarbone, and it's like a finger that's pointing out towards the arm. When we find that bump, we want to come out to the tip of the finger And once we're there, we find that spot, we can begin cross fibering. This is the short head of biceps brachii at the origin. Okay, as we come away from that spot, we're going to come down into the belly of the muscle. I usually have my client turn their palm up, and that kind of shows off that belly a little bit more. And we're going to make a few contact points going down the biceps brachii. Again, when you work on your client, ask yourself to feel for spots that might need the cross fiber. Anything that feels particularly hardened or stubborn or stuck together could be good targets for this move. Okay, feeling strategically down the biceps, all the way down into our insertions. The bicipital aponeurosis goes immediately across this way. It's that thick, broad tendon. And the biceps brachii also inserts onto the radial thumb side, the radial tuberosity, right about here. Once we've gotten the short head and brought it all the way down to the insertion, we're going to come back up. We're going to get the second origin of biceps brachii. That's the long head of the long head. Now we can't go to the true origin, which is on the supraglenoid tubercle. Well, the first place we can find it is when there's a spot called the bicipital groove. So when we're looking for the bicipital groove, we want to come all the way up to the head of the humerus, and we want to feel the very lateral. There's a big bump. We call it the greater tubercle of the humerus. When we go more medially, there's a little bump, and that's called the lesser tubercle of the humerus. Between the bumps, between the big bump that's lateral and the little bump that's medial, there's a canyon in between. So we're going to feel for that little dip, that trench or that canyon. We're going to use a pointy tool because it's a narrow place. So I'm going to use my fingertips this time, and I'm going to sink into the canyon, being mindful that it can be a very sensitive spot, and we're going to initiate a cross fiber here. And again, just try to stay in the canyon, making a few contacts going down. Once you've come down the canyon, you're going to find yourself back on the belly of biceps brachii, where we've already worked on the short head, and we can bring that back down into the insertion again. Once we've done biceps brachii, we're going to do triceps brachii. Now, a lot of times with triceps brachii, it can be actually easier to do that work face down, but for this recipe, we're actually going to keep our client face up, and we're going to do kind of a workaround for this. I'm going to take my client's hand, I'm going to bring them up, and I'm going to use their hand to kind of fold over the top of the table like they're grabbing the top of the table. And then I'm going to use one of my hands to grasp and stabilize their elbow so they don't feel like they have to keep their arm lifted. So go ahead and relax as much as you can. When we go for the triceps brachii, the first spot we're going to look for is actually just behind the armpit. If you feel around here, you'll often feel like there's a tendon, like a ropey spot that goes all the way behind the armpit. This is a spot called the infraglenoid tubercle, and it's the origin of the long head of triceps brachii. So once we find that spot, we're going to go ahead and cross fiber it. Sometimes I might even lock my elbow on the hip if that helps me create good posture, or I could back off and maybe use a straight elbow here. Notice the muscles going this way, so my cross fiber should be going this way. Okay, so we got that origin. All the other origins of triceps brachii are in the posterior shaft of the humerus. So we're just going to go ahead and continue towards the elbow, kind of picking and choosing our spots as we go, creating a cross fiber now in the belly of triceps, all the way through the elbow until we get to the olecranon insertion. Okay, once we've got that, I'm going to bring the arm back down into the posture next to the body. And now we're going to move on to cross fibering the medial and lateral epicondyles of the humerus. Now when we're trying to cross fiber the medial lateral epicondyles of the humerus, remember a lot of times what I'll do is I'll bend the elbow, and remember that the epicondyles are on this bone, not on this one. I'll pinch and lightly squeeze, and I'm looking for the bone. There's a part where the bone kind of flares wide, like if you were thinking of the shape of a triangle at the base. So as I come down to the elbow, there's going to be a bone that pokes wide and on both sides, the medial and lateral. These are the condyles of the humerus. Once I find here's the medial condyle, I'm going to go just superior of that, like I'm sitting right on top of it. And I'm going to go ahead and cross fiber this. I'm standing in a bow stance, pretty much going directly across the table. And I'm just going to go ahead and cross fiber that spot right there. This is the medial epicondyle of the humerus. Again, it's a pretty sensitive spot for most people. Once I've done that, I can use that other bone right here. There's the lateral condyle. I'm going to go just above it and give it a cross fiber here as well. Now you don't have to hold the client's hand up once you're doing that. Great. So those are the medial and lateral condyles or epicondyles of the humerus. Last step in this particular recipe is going to be cross fibering the flexors and the extensors of the forearm. So So we don't really spend a lot of time going over the specific musculature of this area, but in general, we can group all the muscles on the same side as the palm. This is the anterior surface. These are our flexors of the forearm. They bring the wrist closer to the forearm. They flex the fingers into a fist. So these are the flexors of the forearm, so we can just broadly cross fiber here. And again, even without knowing the names of these particular muscles, you can just look for spots that feel like they're really hardened or stuck together, and maybe you can give yourself a little bit more time or attention in those spots. My bow stance is going directly across the arm. You'll notice the arm's coming out just a little bit wide from the table. So my bow stance again is going perfectly perpendicular to it. Good. I generally lighten my pressure when I'm working towards the wrist here. This is a pretty sensitive area. And then once we're done with that, we're going to turn the palm face down. We're going to pronate it, pronate. And then the extensors of the forearm are on the posterior side of the forearm. They're the ones that lift the hand back. They're the ones that flare the fingers open. So all of our extensors are back here. And similarly, we're going to go ahead and cross fiber onto the extensors of the forearm. Now on this side of the forearm, it's easier to go a little deeper depending on how sensitive or how able the client is to accept your pressure. On this side of the forearm, you can sometimes go so deep as to kind of almost press your fingers deep between the ulna and the radius. You wouldn't want to do that on the flexor side. That's considered to be more of an endangerment area because of how many blood vessels and strong tendons and even nerves are going through there. But deeper pressure is often a lot safer to work on this side. So again, we're just going to bring ourselves down to the wrist. And once we're there, if you want to take some time to kind of work on the hands or the palms, that's going to be up to you. We can do a little bit of work there, or we can just do some feel-good work for the hands. Once you've done that, we'll do the same steps of the recipe. We'll do the second side, and that would be the finish of the cross-fibering for the chest and the arms. Okay, so we're ready to do the circulatory recipe now for the chest and the arms. Again, our client's going to be supine. You can see in this particular case, I've already set the drape to cover the chest and to be able to show the areas that we're going to be working. So the first move we're actually going to be doing today is going to be kind of like a half twist. Before I get started, I want to take a moment to use a little bit of lotion or oil to cover the spots that we're going to be addressing. This first move is actually going to do a grasping, pulling motion just around the rib cage here. So I'm going to put just a little bit there, and then the rest of it is going to be working on the arm and the chest. So these are the areas that I'm going to go ahead and effleurage for right now, even coming up to just barely onto the side of the neck here. All right, and so our first move is going to, like I said, it's going to be something like a half twist. I'm going to take my bow stance and I'm going to face it directly across the table. When I go for this one, my first hand is actually going to need to hook around onto the back of the client. So what I'm going to do is I'm going to slide my hand here. I'm going to scoop, lift, and send that hand way underneath. I'm going to start to lift and drag. My stance is doing my pulling by like I'm sitting down into a chair. And once I have a pull going, I'm going to go ahead and match it with a push across the chest and over the arm. Once I get through that, I can kind of use my hands to reset that first. Do a pull and a light press to create that like half twist in the body here. And we can do that a few times. But once you've done that, we're going to change our focus directly into the pectoralis major. I'm going to take my bow stance and face it up and across the table. I'm going to use my palm to do a pressing stroke here. So remember that when we do this, we want to be below the collarbone, and you want to start on the same side of the chest. Don't cross over the sternum. Start at the halfway point and only push out towards the shoulder. Don't go across the middle of the chest here. So we can do a palm, and we might even do like a soft knuckling here. Okay, once we've done that move, then we're going to go ahead and actually do kind of a continuation of this move. What we're going to do next is we're going to push all the way over the shoulder. And we're going to kind of cup our fingers, we're going to lift through the trapezius, and we're going to lightly send our fingers up into the mastoid process. A lot of times as we do this move, the client might allow their head to drift. If they don't, that's okay. But just remember that as you do this move, watch my hand here, I'm going to use my fingers to go up the neck and onto the mastoid process. Try not to mush your palm into their cheek. It can be a little uncomfortable there. So again, pushing through the chest, over the shoulder, grasping and lifting through the trap, and using my fingers, bringing it up to the mastoid process. Now this move is a looping move, so actually we can use both of our hands. I've been using my left, but here's my right. Same applies, using my fingers to go to the mastoid. And when you've trained both of your hands to do this, you can actually do a hand over hand loop. And again, you don't have to do this as a loop, but it can feel really nice as a loop with both hands going. If you feel like it's too complicated, remember, you can always just use one hand at a time and that won't be as complicated. Once we've done that looping move for the pectoralis major and the upper trapezius, we're going to move to the top of the table. From here, we're going to go ahead and find the clavicle, the collarbone. We're going to use our thumbs, try to line the thumb up straight with the wrist, and we're going to do a light thumbing, going from superior to inferior, and kind of like we eat corn on the cob, or like a typewriter for people who might remember those. And we're going to come all the way out to the lateral clavicle, and we might even give this a couple layers. Great, and once we've done that, we're ready to move on to the arm. All right, so for the next part here, we're going to be working on the arms using our advanced circulatory moves. We have the client supine. We've again shifted the table so that way it's easier for you to kind of see us, for us to talk while I'm doing the work here. So our first targets are going to be on the upper or the proximal arm. We're going to be working on the biceps, the triceps, and the deltoids. So I'll go ahead and take what lotion or oil that I have, and I'm just going to go ahead and effleurage that on, create a nice glide. All right, and our first technique is going to be a palm stroke. I'll go ahead and place the hand up in a supinated posture. I might even bring it just slightly away from the body. And you'll notice in this particular case, I might take a bow stance here, but that kind of puts me in an awkward position, so I'll be aware of where the client is laying and just make sure that I'm not standing in a suggestive or dangerous spot. So I'm going to take my palm stroke and we're going to palm, and notice when I palm, I'm going to go over the deltoids. I go up the biceps, over the deltoids. So each of your strokes, you want to get the biceps and the deltoids. Don't just stop right here. Okay, so palming, knuckling, trenching. Remember that trench has to have a lifted palm. It's a pointy tool, but it doesn't have to be a heavy one. Then we can thumb. And then finally we'll bring our iron in. Notice how much lower I get in my stance when I bring my elbow out. All right, good. Now that we've gotten the biceps, the deltoids, we're going to take the arm, we're going to fold it back, we're going to make a hand that's going to grasp the top of the table. And I'm actually going to face down the table this time, and I'm going to palm stroke through the deltoids all the way through the, through the triceps and down the deltoids. So palm strokes here. Knuckling, trenching, thumbing, and then finally we can bring our iron through. All right, great. Once we're done, we can take the arm, place it back down at the side in neutral pose. I'm going to place it into a supinated posture one more time. We're going to work on the flexors. This is the last couple steps that we have here for our circulatory. So we're going to palm the flexors. I really want to start almost over the wrist, through the elbow to really get a whole forearm here. Notice how I'm kind of not just going over the same middle spot, but kind of taking a little medial, taking a little lateral, using my knuckles now. Now you don't have to hold their forearm, but a lot of times stylistically I do tend to just lightly hold the hand, stabilizing their arm. Trenching. Thumbing. And in truth, an iron doesn't always really work really well here. You can give it a shot, but I'm not going to include it in this particular spot, especially for the forearm. Again, remember, this is a more endangered just because there's more blood vessels and nerves. Easily kind of disrupted here. But once we're done, we can turn the forearm down, pronated, and we'll palm now the extensors. The knuckle. Trenching. thumbing. And again, an elbow is often a little too big, sometimes too strong for this spot. Once we're done with the forearms, we'll bring it down, we'll work the wrist. Out into the palm, into the fingers. And when you're done, we're just going to repeat these moves on the second side, and we'll have finished the circulatory recipe for the chest and the arms. Congrats!